Many women have urine incontinence. Many women leak urine and they do not know where to go. They didn't even know it's gynae's problem. They don't even know that you're supposed to see a gynae for your urine leakage. And as a result, they live with it. You need to understand urine leak can happen at any time of your life. It can happen when you are younger or older, but we know that most women have urine leak only after childbirth. It's more common after childbirth, number one, and it's also worsen as you grow older. So most of the time about menopause, around in your 40s, is when it worsens. Okay, so what are the types of urine incontinence? We usually say there are few types. The first one is the commonest one. Commonest one, we call it stress incontinence. Stress incontinence means you must do something before the urine leak. For example, you cough and the urine come out. Oops. So this is stress incontinence because you stress it. You must have a certain stress, a pressure because the urine come out. So this is stress incontinence. So this stress incontinence, what do we do? What can we do? So simple. First, you need to do Kegel exercise. You need to do pelvic floor exercise. So this is something that I routinely teach my mothers in my antenatal classes, or any women in my clinic tell me they have stress incontinence during pregnancy. I will also immediately send her to my physiotherapist to learn how to do proper Kegel exercise. And if done properly, most of these women improve within the week. If you do a good Kegel exercise, you should have this problem solved within 1 week. So you need a physiotherapist that specializes in women's health. That is the best people to go to, where they specializes in all this pelvic floor and they're very good at it. Within a week, I see many of they already can control their urine. Let's say one day, whatever you do, your Kegel exercise, whatever you do is not improving anymore. It will reach a stage, especially when you're much older. If you're much older, then sometimes exercise may not help anymore. So what happens is you have the second alternative, which is surgery. We always leave surgery last. So what happens in surgery is very simple. Down there, I made a small cut, put in the ribbon, I tighten it, and then that's it. The wound is only about 1 centimeter, very tiny little wound. After this, I do this, you can go back on the same day, and then and you can pass urine like normal, you don't need to worry. Life goes on as usual the next day. So that is urine incontinence for stress incontinence. Second most common incontinence is we say urge incontinence. Urge incontinence are whereby you always feel like you want to go urine. You go to toilet, you come out. After a while, you want to go toilet again. Not only that, sometimes if let's say the toilet is very far, or for some reason you cannot find a toilet, or some reason you're on a car, you're on a train, you're on a bus, and then there's no toilet, they need time to go reach the toilet. They need then maybe another 10 minutes because they reach the nearest toilet. And then before you can reach the toilet, your urine come out already. That is urge incontinence. So the thing about urge incontinence, they must have urgency. They feel they want to pass urine. And many of these women, they actually pass urine very frequent. While they go toilet. It's not due to pelvic floor, it's all due to your bladder cannot keep so much urine. What happens is that these women with urge incontinence, the bladder capacity has shrunk to a smaller capacity. Urge incontinence is a much difficult incontinence to deal with because it's due to many reasons and there are many things we need to do. So these people, in the first place, again, we will teach them Kegel lah. But more important is not that. We have to train the bladder. And this thing, who teach again? Physiotherapists. So it's again the physiotherapist. So they will train you to retrain your bladder back. And last of all, we will usually also go for a stress assessment. Why stress assessment? Okay, I need to tell you that urine incontinence due to urge very often is also stress related. So when women come to me for urge incontinence, I don't just treat them for their bladder retraining, see physiotherapists. I also make sure they go and see my counselor to look at their stress, to understand the stress that they are having and what are the stresses that make them have this urgency. And last of all, of course, got medication, got medicine one. Actually, this urge incontinence got medicine one, but this medicine have a lot of side effects. So for me, I give this medicine if my patient want the medicine, but I also usually tell them, you take this medicine as a temporary measure, but you still need to see my physiotherapist, you still need to see my counselor. As a team, we will work together to help you.